Hello, and welcome to our YouTube channel, where we discuss all things related to Medicare and Medicare-approved plans. Quite simply, when clients come to us, we help them in three ways. First, we unconfuse Medicare plans for them. Then we answer all their questions. And then we show them which plans they are eligible for, all at no cost. Now today, we'll discuss the cost of Medicare Part A, Part B, and Part C. So let's get started. And please be sure to like our page. And if you're looking for quick yet thorough explanations of the various parts of Medicare approved health insurance plans, be sure also to subscribe to receive notifications when we post new information. Let's start with Part A. Part A covers, of course, hospitalization. Medicare Part A has no monthly premium for people who worked 40 quarters and paid Medicare taxes. You can also qualify for Part A coverage if your spouse worked 40 quarters and paid Medicare taxes. This is called premium-free Part A, and most people on Medicare, in fact, have premium-free Part A. Eligibility for Part A begins at age 65 and is based on work history. Now, if you're younger than 65, you can get premium-free Part A if you receive Social Security disability or Railroad Retirement Board disability benefits for at least 24 months. Also, if you're under 65, you can get premium-free Part A if you have end-stage renal disease or ALS. Now, if you don't qualify for premium-free Part A, you can buy Part A. When you buy Medicare Part A, your monthly premium will either be $274 or $499, and it will depend on how long you or your spouse worked and paid Medicare taxes. If you decide that you don't want to pay for Part A, which is hospitalization, you can still buy Part B. Now let's take a look at Medicare Part B, which of course covers medical services. The standard Part B premium amount in 2022 is $170.10. This is the amount most people pay. However, if your income is above a certain level, Medicare increases your monthly premium accordingly. The increase is based on your modified adjusted gross income as reported on your IRS tax return from 2 years ago. This additional premium is added to the standard premium and is called an income-related monthly adjustment amount. Yes, IRMA is an extra charge added to the standard monthly premium you pay. Additional Part B costs include deductibles and co-insurance and co-payments. In 2022, the Part B deductible is $233. For co-insurance, usually you pay 20% of the Medicare-approved costs for these three services: most doctor services, outpatient therapy, and durable medical equipment. Last, let's look at Medicare Part C. Medicare Part C includes all the Medicare-approved Medicare Advantage plans. Part C costs include the monthly premium, the annual deductible, co-payment, or co-insurance. Now, the monthly premium, the co-payment, the deductible, and the co-insurance, those vary based on the plan. Regarding the monthly premium, many Medicare Advantage plans have a $0 per month premium. There are plans with monthly premiums higher than $0, and monthly premiums vary. It's important to know that whether you enroll in a Medicare Advantage plan with a $0 monthly premium or higher, you still must pay the Part B premium and the Part A premium if you don't have premium-free Part A. Some Part C Medicare Advantage plans help pay all or part of your Part B premium. This benefit is called Medicare Part B premium reduction. Deductibles. Part C plans may have an annual deductible, and some Part C plans have an additional deductible. The deductible is the amount you pay for services before your Medicare Advantage Part C plan begins to pay. Actual deductible amounts do vary. Co-payments. That's the set amount you pay as your share of costs for medical services that you receive, like a doctor's office visit or hospital outpatient visit. Coinsurance, that's the amount you pay as your share of costs for services after you pay any deductibles. Coinsurance is usually a percentage of cost of service, for example, 20%. The last cost that we'll talk about today is the maximum out-of-pocket cost limits. This represents the most you'll pay for covered services in a planned year. After you spend this amount on deductibles, co-payments, and coinsurance for in-network care and services, your Medicare Advantage Part C plan then pays 100% of the cost of covered services. Some examples of maximum out-of-pocket costs are $6,700 or $7,500. Now, let's summarize. We discussed the main costs for Medicare Part A, Medicare Part B, and Medicare Part C. We'll discuss Medicare Part D costs in a separate video. Thank you again for joining us today, and I hope you found the content informative. Do like our page and also be sure to subscribe so you won't miss new weekly videos providing more helpful information about Medicare approved plans. Bye-bye.